To the BHF Data Science Centre monthly webinar. My name is Smira Khan and I am the Patient and Public Involvement and Engagement Manager for the Centre. So this month's webinar will be delivered by Jackie MacArthur, our Senior Scientific Programme Manager, and Michelle Williams, our Associate Director for Unstructured Data Thematic Area, and she's also a Senior Lecturer at the University of Edinburgh. And their talk is entitled Amplifying Patient and Public Voices, Sharing Results from Our Cardiovascular Research Priorities Survey. We'll also be joined today by Phil Blakelock and Julian Meldrum, our public contributors who have supported the development of this survey, and we'll be talking to them about their experiences and their involvement throughout as well. So just before we begin, a little bit of housekeeping. If I can ask everybody just to kindly keep their cameras and microphones switched off. And just to note that the webinar will be recorded and it will be available afterwards on the HDR UK YouTube channel as well. So at the end of the sessions and at the end, we will have time for discussion. So please do add any questions that you might have in the chat function, and we'll try and answer all the questions that we can throughout as well and at the end of the presentations. I think that's everything from me. Without further ado, I'll hand over to Jackie.
Thanks, Samira. I'm just going to share my screen. Hopefully you can all see my slides now. So as Samira mentioned, I'm going to be talking about the results of the survey we carried out into public views on cardiovascular research priorities. So this slide just gives an outline of today's webinar. So first you'll be hearing from me around what we did in the survey and the results that we found. We'll then be hearing from two of our public partners, Phil and Julian, who will be joined by Samira. We'll then be showing you a video from Michelle on the next steps and the impact of the survey results. Michelle will also be joining us for questions. We've just got a video of her input because we knew that she might be travelling today. So our aim in carrying out this survey was to gather input from the public on what areas of cardiovascular disease research they think are the most important and how do they think that research should be prioritised. We'll be using these results to help us prioritise what areas of research should be focused on. These will be used to inform the BHF Data Science Centre's plans moving forward. The survey was co-designed with our group of public partners, and it went around several rounds of iteration in making sure that the wording that we used and the information that we provided to the public in filling out this survey made sense and was easy to understand. The survey included questions on the types of research that people think are most important and how research should be prioritised. We also included a series of questions about the respondents, to identify which stakeholder category best defined their role, because we wanted to try and gather input from patients and the public in particular. We also asked whether people were resident in the UK. We asked a series of demographic questions because we wanted to try and gather as much representative input as possible. The demographic questions will allow us to assess what parts of the population we might need to gather additional input from in the future. The survey was carried out in SurveyMonkey and it ran for 2 months over the summer of 2022. The survey was widely communicated via public involvement groups, both directly and via email newsletters and by asking our contacts to disseminate it around their network. Via Twitter and just paid advertising campaigns to try and get wider than our usual followers. And via professional societies with potential patient links. It was also advertised on social media, including Twitter, LinkedIn, Facebook and YouTube. And we provided additional information via an article which we link to via these sources. So in total, 568 people accessed the survey. As I mentioned, respondents were asked to identify which stakeholder category best defined them and to indicate if they were a UK resident. Of the 487 respondents that I identified as a member of the public or a patient, 354 were also UK resident and went on to complete the survey. So the results that I'll be presenting over the rest of the slides represent the results from the 354 members of the public and patients that were resident in the UK. This shows the ages of the respondents. As you can see, that the numbers increase with age, with more older respondents. This possibly reflects the increased incidence of cardiovascular disease with age. This slide shows the gender of the respondents. And you can see that we had more responses from individuals that identify as female. This could reflect the fact that we carried out the survey online and that the methods that we communicated the survey. So as you can see here, that the majority of the respondents were identified as white, which is as you would expect. We received a total of 4% of responses that were from non-white individuals or individuals that identified as non-white. This is lower than you see in the population as a whole, which is 18%. So ideally, we'd be looking at gathering a higher number of responses from non-white ethnicities. And in the future, we'll be looking at how we can do that. The survey included 2 questions focused on cardiovascular research and how this should be prioritised. The first question asked, which area of research are most important to patients and the public? Respondents were presented with a list of 10 areas of cardiovascular disease research, and they were asked to rate each of these from 1 to 5, with 1 being not at all important and 5 being very important. This slide shows the weighted average of the ratings given to each of these areas of research. As you can see, all 10 of the research questions or the research areas were scored highly by patients and members of the public. The top 3 research areas were improving treatment, improving the quality of life of patients, and improving diagnosis. We also received additional suggestions for areas of research which maybe weren't suggested in those 10 areas of research that respondents were able to choose from. The additional suggestions, many of them were focused on increasing the understanding of the risk factors for cardiovascular disease, including lifestyle choices, genetic risk, and other risk factors, and also around using this information to improve prevention. The second question that we asked respondents asked, how should research studies be assessed to decide which should be funded and carried out? Participants were presented with a list of 13 ways of assessing research studies. These were taken from common ways that funders often use to assess research studies, along with additional reasons which were suggested by our public partners. Respondents were asked to rate each of these from 1 to 5, again with 1 being not at all important and 5 being very important. This shows the weighted average of the ratings given to each way of prioritising research. You can see here that the top or most valuable way to prioritise research was based on whether it had a positive impact on the lives or experiences on patients. Other popular factors were whether it has the potential to be used in the UK healthcare system, whether it's an important question to address, and whether it reduces inequalities in healthcare. So to summarise the results of our survey of over 350 UK public and patients, the top areas of research were improving treatment, improving the quality of life of patients, and improving diagnosis. The top way to prioritise or assess research to be carried out was that it should have a positive impact on the lives or experiences of patients. So we're now going to hear from Julian and Phil on their thoughts and the thoughts of our public partners on these results. So I'm going to hand over to Samira now, and I'll stop sharing my slides.
Thank you, Jackie. That's brilliant. Thank you very much for that talk. So as Jackie mentioned, we've been working very closely with our public involvement group, and they've helped us kind of develop the survey, and we'll continue to work with them in terms of dissemination and next steps, I believe. So what I'd like to do now is really talk to Phil Blakelock and Julian about their experiences. So I put some questions together for you both, which I just wanted to ask you, just to explore your experiences and get your thoughts on the actual survey as well. So my first question is, just for the benefit of our audience and just to kind of take a little bit of a step back, is what motivated you to get involved with the work at the BHF Data Science Centre? And Julian, if you want to go first.
So I volunteered a few years ago for a sports cardiology research study, thinking I was nice and fit and healthy. And the downside of research is sometimes you discover things you didn't know. And the thing I discovered was that I had a condition I'd barely been aware of, but it was out there on the echocardiogram, which I saw, and was confirmed on the CT scan and the MRI. So I have an enlarged ascending aorta, and I've been on a journey of discovery about this condition and quickly run up against the limits of what is actually known about it and what the risks are associated with it. And one of the things that I'm become very aware of is that the only way we can really get answers about conditions like mine, but also a lot of other cardiovascular conditions, is through looking at large populations over substantial periods of time and crunching data. And so that, together with the fact that my condition was diagnosed on imaging, it's being monitored with imaging, it may even be treated through imaging, has given me a particular interest in the imaging side of the Data Science Centre's work, and I totally support that. But I'm also interested in the broader data science connections. I'm a volunteer with Our Future Health, which BHF is partnering in, which brings in genomics and ties that with NHS medical records. So I am very aware of the power of all this, and am very excited and fascinated to have had the opportunity to participate and give some input into it.
That's brilliant. Thank you so much, Julian. Phil, what about you? What motivated you to be involved with the work with the centre?
Yeah, thanks, Laura. Yeah. I underwent an operation around about 5 years back for a bicuspid aortic valve. That was April 17, probably 6 years ago now. Prior to that, maybe 6 or 8 weeks before that, I was approached by a young chap who was doing a PhD at Oxford in, he was studying the molecular makeup of heart and muscle. And he was looking for volunteers to endure multiple MRIs to achieve that end. Now, during that, I described myself as 3/4 engineer and 1/4 physicist. So when I saw the MRI data that he was crunching out, I was absolutely captivated by what it was showing us, not me because I didn't understand it all, what it was showing the medical community, and how I could see how this could be used in the future to identify what I now know are biomarkers of potential conditions that people may develop over 10 to 20 years. So it immediately struck me as being for the future, really, data collection and data analysis, this kind of science to me seemed absolutely the way forward. I suppose my views are similar to Julian's in some ways and different to Julian's in some ways. But I think we both agree on the value of imaging and the value of data and the fact that we really need to pursue this. Yeah, so all around it seemed to me like a very positive thing to pursue. That's why I'm involved.
Excellent, thank you. And we really, really appreciate your involvement. So my next question, just bringing you back to the survey. So thinking back about what Jackie's just presented, and I know you've both been obviously involved with the development of the survey. Thinking about the results, what are your general thoughts on the responses that we've received? Julian, if you want to kick us off.
I think they show a really strong appreciation and that there is actually a big constituency out there among people who know they've got health issues, who know there are health issues in their families and their communities, to have more work done on the conditions that affect them. And yes, they are interested in how this is going to impact their own lives and the lives of the people around them. And so the more that is clear to them and the more obvious it is, the more supportive they're going to be. But that doesn't rule out other possibilities as well. So I find this very encouraging, and I hope that other people will find it encouraging too.
Excellent, thank you, Julian. Phil, what about you? What are your general thoughts?
Yeah, sure, thanks. I was quite surprised how flat the results were. I thought they'd be more pronounced. My general summary is that I think questions 1 to 5 I'll describe as the here and now. This is health today. Whereas I think the focus should be on, I think it's questions 8 to 9, which I regard as the future. These are things that will affect things in 20 years' time, which I think is where a lot of focus should be. And having worked with multiple groups with the BHF and others, I know there is a lot of focus there. I think we should not lose sight of the fact that the here and now is the here and now. We need to be prepared for the future. We need to be doing things now that will help us in 20 years' time. To that end, I would suggest that, in my opinion, only the medical community should be aware of the need to show leadership in developing that future vision.
Brilliant, absolutely. Thank you. That's been really useful. So my final question, you'll be glad to know, just reflecting back on your experiences with the work with the BHF Data Science Centre, what would your message be for researchers that we have today on the call and in our audience in general? Julian, if you want to kick us off.
I'd say we see a big exercise in prioritisation, and prioritisation obviously implies some things being put ahead of others. I would say don't be upset or put off by the fact that some things may have been pushed rather down the list. I would take away the message rather that if you can explain things clearly, if you can articulate how it's going to affect the experience of patients in the future, how it's going to make the functioning of the health service more effective, how it's going to deal with things that people really do care about, then you will get support for it, certainly from the public. I think there is a lot to be gained there, and that it's well worth getting some of that involvement and making it overt, because as the BHF has articulated, and it's one of the main reasons for investing in this whole area of research, the political support and backing of the public is crucial in enabling this to happen. And I think we all have a part to play in making that happen.
Absolutely. Thank you, Julian. I love that. We all have a part to play. Brilliant. Phil, what about you? Thinking about your experiences, what message would you have for researchers?
Yeah, sure. I think it's really important to remember that the general public has a very different perception of medicine than do the medics. I'm reminded of a time I was invited to participate in an all-party parliamentary group at Westminster on AI in cardiology, which I found absolutely fascinating. And following several meetings, one of the conclusions was that the public were concerned that AI, they would have medical judgments made upon AI. However, if you wind that back a little, they were happy to have their condition analysed by AI, and not for a conclusion to be reached or for treatment to be delivered by AI. And they still wanted their GP to do that, or their consultant or whatever. So I think for me that was a very important message, that AI is massively valuable, but you've got to handle it right. I'm also reminded of the time when there was a presentation by some university again at Westminster on with a robot sat in front of a lot of MPs. That was the wrong message to sell. So to the medical community, I would urge you to be mindful of the difference in understanding of things between medics and the public, and the need to deliver perhaps the potential benefits of AI and data and data analysis correctly to the public, because there's a massive amount to be gained if you do it right, and a massive amount to be lost if you do it wrong. So to that end, it's vital to construct and disseminate a credible argument to get the trust of the public. And the other comments like, how do we know our data will be secure? How do we know it won't be sold to a multinational corporate for lots of millions of dollars? So there's lots of messages that need to be constructed here.
Brilliant, Phil. Thank you. I think that's extremely useful. And I agree about sort of the contribution to trust and transparency. That's really key, isn't it? Brilliant. Right. Thank you so much, Julian and Phil. That's been really, really insightful, really, really useful. And I'm sure people really appreciate that. And just to say that you've been absolutely brilliant for us at the centre as well, and helping us and supporting us with the work in this thematic area.
First of all, I'd like to say a huge thank you to Phil and Julian. Been fantastic today. Really great to get your insights. Fantastic to work with. And we really appreciate it. I'd also like to say a huge thank you to the rest of our PPIE group who've helped us with thoughts and ideas around this and the other things that we're working on. I'm Associate Director for the Imaging and Unstructured Data theme, but there's lots of other themes that they're helping with as well. A huge thank you as well to Samira and Jackie and the rest of the Data Science Centre staff, and also to everyone who helped with this and our other surveys. This is all a real big team effort, and it's made even better by having all of these thoughts and opinions. The results of this survey, just my sort of summary and thoughts of it, it really helps us to understand both the types of research that patients and the public think should be prioritised, and it also gives us some ideas about how we should prioritise them. The big take-home message for me is that researchers really need to ensure that in some way, whatever research they're doing is relevant to that key message of having a positive impact on the lives of patients. And the discussions of the wider PPIE group today and over the course of the past few months have really been very informative around that and shaping those sort of thoughts and ideas. So what's next for us then? Well, the results of this survey are going to inform the work of the British Heart Foundation Data Science Centre. It's one of a number of things that we're doing to make sure that the views of patients and the public are central to everything that we do. In my theme, the unstructured data and imaging, it's already helping us guide us as to what we're doing. We've used the results of this survey to inform a prioritisation exercise that Julian had mentioned there, looking at over 100 research questions. And we used this survey to select both the types of research questions and also how we prioritise the research questions. So those are two really central parts of this larger research. And it'll also have an impact on the other areas of the Data Science Centre. So we've got structured data, personal monitoring data, computable phenotypes, data-enabled trials, and enhancing cohorts as well. So these are all things that we can use this survey to reflect back what we're doing. And this research will be invaluable for other researchers, planning projects, funding bodies, and other organisations as well. And the results of this survey can help keep the views of the patients and the public at the centre of any research questions that are being developed. And as Julian suggested, it doesn't mean that other research isn't important. Other research questions are important. It's just a way of thinking about how we frame them, how we structure our projects, how we communicate our results, and what extra things we need to add in to some of our research projects as we're developing those ideas. So thank you for everyone who worked on this project. Thank you for everyone who participated in our project. Thank you to Julian and Phil and our other PPIE members. And if you've got any thoughts or comments or questions, please do pop them in the chat there. So thank you very much.
Thanks, Michelle. That's brilliant. Okay, I think we can open the floor now to some questions. So if anybody has any questions or any thoughts or any comments that they'd like to share, please do put them in the chat, or you can use the raise hand function and we can speak to you. Okay. Kathy, brilliant. Welcome to you.
Yeah, just kicking off in case there was an awkward silence, but also because I always have questions I'm itching to ask. So my question is of Julian and Phil. I don't know whether you were involved directly in this survey. I suspect you probably were, but obviously you've had a good look and reflected on the results. Do you think there are remaining questions in this general area that it would be useful to be asking members of the public? Do you think we got the kind of scope of the questions about right? Are there sort of unanswered questions to your mind dangling over that we should also incorporate into our future thinking, as well as incorporating the advice that we've received through the survey, which very rightly has alluded to?
Julian, I do. I can chip in if you wish, Kathy. Yes, we were certainly involved in the early stages of the question formation. My personal view is they are good questions. They're about right. I think there's a danger that you not trying to ask too many or too detailed questions ceases to be valuable. I think you're getting a good general feedback from the public on these 10 questions. The one question we didn't actually discuss was the environmental one, if you recall. There was quite a low response on the environmental one. I don't know whether you want to pick that up at all.
Yeah, that was a really interesting one, actually. The environment, research questions that impacted the environment was rated lowest on the survey. Now, all of the questions were rated fairly high. They were all sort of 6 and above on the scale, which is reasonably important to very important. But the environment was lower. And it's been really interesting chatting to people about reasons that was. Is it because people don't think the environment's important? Well, it doesn't really seem to be when we're chatting to people about the results of the survey. And the other thing that people have said, well, actually, it's not that it isn't important. It's just that maybe the other things are more important, and maybe health questions rank higher when you put these together. But it's a really interesting one, Phil. I agree, and not necessarily what I was expecting.
Yeah, I think my view is that it was yes, of course, it's important that no one's anti-environment, but at the end of the day, I would have thought that the medical community aren't contributing that much to environmental problems, and obviously health is pretty damn important.
Yeah, and the other one that came up is that some people didn't necessarily realize that link between the environment and health treatments, and that's something that maybe we need to think about exploring a bit as well. Does anyone else have any other thoughts on that one?
I thought I would go back to answering or trying to answer Kathy's question about were there other areas of research. We have a really good picture, I think, of a set of questions from a cardiology perspective. If you're coming into cardiology from a different angle, and in a way my own personal experience relates to that, in that I came in through sports and sports screening, and that opens up a whole set of other questions which really can be quite challenging about what does it mean when you find certain things in the hearts of people who are maybe older sports people, and not coming in with concerns about their heart conditions, but they're suddenly told they have, in my case, apical ventricular hypertrabeculation. And is this a bad thing? We don't know. And so there's a range of things. And I think when you come into asking questions, for example, as has happened with the pandemic, what do minor respiratory infections really mean for people's lives and their future risk of cardiovascular disease? And you can go into imaging and biomarkers and other tests and see things which might be alarming. How alarming are they really? It's a really tough question to answer. And yeah, it's going to be a burning question for a lot of people. But where does that sit with the more traditional concerns and very legitimate concerns of cardiology?
It's a really interesting answer, Julian. You're kind of raising the very thorny issue, which you have experienced yourself, of what we might call incidental findings. And these are very common particularly in imaging research studies. And there's quite a lot of research on incidental findings and how they should be handled and so on. You're probably familiar with quite a lot of it. So that might be an area that the BHF Data Science Centre would like to think about doing some work in the context of cardiovascular imaging specifically. I know it's an area I've been very interested in the past. We probably don't have time to do it justice in this session because it's a whole can of worms, but it's really good. It's really interesting to know about your personal experiences in that regard. I think it brings that different perspective. Thank you.
Brilliant, thank you. Yeah, some stuff we can move forward with. So we've got a few questions coming up in the chat, and we've got a hand up as well. So I'll come to the person who's got the hand up first, Lawrence, and then we'll go into the chat.
Hello, I have an interest in what we're discussing here from 2 points of view. In that I'm an elderly data analyst, so I spend quite a lot of my time ploughing through data, but I have been a cardiac patient. I've got an artificial heart valve, a 3-lead pacemaker, and tomorrow morning I'm going in to have the battery changed. So I have a view from both the short-term and the long-term aspect of this. I'm a bit concerned about the sort of short-termism you get when you go to the general public, because by and large the things which are benefiting us today have been in the making for years or decades. And I think the danger is, if we're not careful, that we will take too short a term of view. You have to have a short-term view, because if you don't, you'll be dead before the new treatment is available. And I'm very glad to hear that people are taking it so seriously. I found I had several medical procedures lined up, and I said to the people in cardiology, should I postpone the other ones, or will you postpone what you're going to do to me? And they just said, cardiac trumps everything. And I think there's a touch of truth in that in hospitals. So I think the danger, if we're not careful, is it will go for the short term and quick fixes. And if we're not careful, we'll delay for too long the longer term considerations. You mentioned AI. I don't know how many of you played with ChatGPT, but it's quite amazing what can be done nowadays. It's clearly not human. Yeah. But in some ways it's better than human, and in some ways it's much worse. But I think we should be thinking of that as a way of prioritizing our research as well as doing it. Now, you won't be able to see me moving because my camera's not working. At least you've got my picture in the top left-hand corner. Thank you very much. I leave it at that.
Thank you so much, Lawrence. Yeah, go Michelle.
Thank you. I was just going to say as well, thank you so much, Lawrence. Firstly, I hope everything goes well tomorrow. And secondly, you're entirely right. As Phil said, like, some of these questions are about today, tomorrow, the next few weeks and months, and some of them are a much longer term future. And we always need to leave room for that blue sky thinking, that thing that no one had ever thought might be possible. Because as you say, like a few years ago, no one would have thought ChatGPT, the AI tool that everyone's talking about at the moment, would be possible. And these sort of things do have the potential to help us in the future as well. So yeah, you're right. Always leave space for the blue sky thinking.
Absolutely. Brilliant. So a few questions coming in. There's one for me here about, we've heard from approximately 400 patients, how will you ensure you reach a wide and diverse range of participants in the future? Really great question. And I think this is something we've been discussing as a group as well in terms of the PPIE group. And one thing we've been made aware is that one size definitely doesn't fit all. And we know that, you know, one approach is not going to work for everybody. So when we were thinking about developing this survey, we knew that, you know, it's not going to reach the whole population, but it gives us a platform to start to kind of identify the gaps in terms of who we're not reaching out to. So we've really sort of thought about how we've been thinking about various different approaches of how we can reach out to more sort of diverse groups and different demographics. And we've been thinking about a sort of more targeted approach. So we'll look at the data that we currently have and where the gaps are, because the survey has provided us with that. And then we can sort of take a more targeted approach and think about whether dissemination and whether we need to sort of reach out to sort of different ethnic groups and people from different backgrounds, and perhaps a different mechanism about us going to them and using sort of charities and community organizations to actually go to them and talk to them about the survey rather than having an expectation of them coming to us. So that's definitely something that we're looking at and exploring as well to widen participation in the survey. So I hope that answers your question. Let's have a look. I think we've got some more questions. Dan Taylor, really interesting results and presentations. How will you be integrating the findings into how the centre works to ensure these are supported and reflected in research going forward? So Jackie or Michelle, if you want to take that one.
Yeah, I can pick that one up. It's important. You don't just want to do a survey and then no one ever reads it again and it gets lost, and all that work is not useful. So what we're doing is, in my theme, anytime we're thinking about our next project, we're always looking back at these questions with each of the projects that we're doing, making sure that they reflect these questions and these areas that people have told us that they're interested in. So it's really about integrating that into each of the things that we're doing. And the second thing is we have members of the patient and the public as part of the steering committee or organizing groups of each of these different projects as well. So we make sure that those voices are always heard. And Phil and Julian keep us right, actually, in one of our steering committees when we've forgotten something, when we've ignored something, when we've not picked up on something. They really do keep us right, and we really appreciate that. So it's about making it a part of our everyday rather than in the past, engagement was something that you did at the end of the project once everything was done. For us, it's about doing it from the beginning all the way through, right to the end and beyond. So hopefully that helps. I don't know if Kathy or Jackie want to add anything to that.
Can I just add as well that we will be writing up this survey and the results for publication, both scientific publication and also communicating it out wide to the public. So these results will be available to inform kind of wider scientific research and available to the community to be used in the future. And I saw there was a comment as well about making the slides available. Just to confirm that, so this is being recorded and will be made available by our YouTube video, and we can make available the slides as well.
Absolutely. Dan, you've got your hand up. We'll come to you.
Oh, thank you. I was just curious about this comment about selling the data, who owns the data, how the data's managed. The project is being done, or some work is being done in collaboration with Our Future Health, which is obviously looking at genome data. How is this question being addressed? What tools are being put in place to kind of manage this data ownership question?
That question actually came from me, and that's the parliamentary group that I was privileged to be part of. The question was raised because there's a view that, you know, if you get a data set of, I know, 1 million or 10 million sets of data, then it might well become attractive to a large corporate to buy it and exploit it. And there was concerns over security of doing so. Now, my involvement in that group ceased following the final presentation at Westminster. But to be honest, I don't know what the future steps that were taken were. But if you wish me to pursue that, I will. And I'd find it quite interesting myself. I guess you could probably see the issue. It's very tempting for somebody to try and exploit that data when they really have no right to do so.
Yeah, thank you. I'll be interested.
Brilliant. We can put you in touch then.
Good.
Phil, brilliant.
Yep.
Okay, Kathy, you've got your hand up.
Yeah, it was really just to pick up on that good point that Phil raised and that Dan has also raised as well. So just to kind of give a little bit of context, as the director of the British Heart Foundation Data Science Centre and the chief scientist of Health Data Research UK, which is the institute in which the centre sits. So the Institute Health Data Research UK is very much involved in conversations about this very point. So more broadly across HDR UK, there's a huge piece of work to work jointly and collaboratively with patients and members of the public to understand issues of trust and transparency around a range of different types of uses of their data. Many people take part in studies where they give explicit consent for certain types of use of their data, and that is the route, for example, that is used by Our Future Health and other similar large and indeed many smaller studies, trials, and other cohort studies. There are also there's also work that is carried out with data at whole population level, and we've been involved in leading some of that work that's done without the explicit consent of every single person whose data might be included. The data are de-identified before use, and certainly anything that we're involved with, all the work is done in what's called a secure or trusted research environment, so that there's no data taken out of the environment. There are very clear rules around protecting the privacy and security of individuals. There is checking of any kind of tables or figures or aggregate data, is what we call it, that are taken out of the environment for use in reports or publications. So there's a number of different security layers. The other thing to say is that Health Data Research UK and other colleagues of mine are very involved in this, is involved in informing policy and co-developing policy at kind of NHS and government level on this. But it's a very, very important point because, as you well know, trust is difficult to earn, difficult to maintain, and really, really easy to lose. And so we rely on very good, strong and transparent relationships with patients and members of the public in sort of coming with us on this journey towards responsible and beneficial uses of their data. We don't yet, I think, have it all right. There have been across the community of users of data mistakes made, and probably one of the most important concerns that's raised again and again, and you've both raised it, is the one around uses of data by organizations that may add benefit but may also gain commercially. And there's a piece of work going on as well around trying to work through the value of data and the way in which benefits should be returned to the NHS. I think there are also issues of trust in government which influence the public and professional perceptions of whether what's said to be happening is actually what is happening, which again is another can of worms. But I think all of these things are incredibly important. So your involvement in these conversations is key.
I think the key phrase though was, Kathy, was the return of value to the NHS, which is absolutely key. We could do lots of work, put lots of effort in, lots of money, and get nothing back. So it has to be protected for that reason.
I completely agree, and Samira, I'm sure will pick up with you, Phil, Dan, and if you're able and willing, and others to sort of feedback some of these views and help integrate your thinking into some of the broader conversations that are going on. If you're interested, that would be fantastic.
Yeah, sure.
Brilliant. Thank you.
Absolutely. Yeah, definitely get in touch. So just looking at the time, it is 1:45 and we do have a few more questions which we can definitely pick up at a later date, I think, and come back to you. So we've got a good question from Elizabeth, which I will just quickly touch on because she just said, how do we actually evaluate PPIE impact? And Elizabeth, I think that's a really good question because there's so much different impact tools out there, aren't they? And we have a really simple one here at the Data Science Centre where we just talk to our PPIE group and we look at it from a research perspective and sort of organizational perspective. And from a research perspective, we certainly look at, what's changed as a result of PPIE and that kind of thing. But we also continue to speak to our public contributors to make sure, from their perspective, that they're getting something out of it as well. And there's impact on both sides for the research, the organization, and from the public as well. So hopefully that answers your question, but we can pick that up at a later date as well. And we can definitely share some of our mechanisms with you as well. So I think that brings us to an end. So thank you so much to all our presenters, Julian, Phil, some great discussions, I think, been brilliant, and loads of stuff to take forward as well, I think, some next steps and work to do. So thank you to everyone, and thank you for listening. And as we said, this will be uploaded to the HDR UK YouTube channel. So if anybody's missed it, we can share it with people. And also, if anybody is interested in sort of sharing information at one of our monthly webinars, then please do get in touch with Kate McAllister, our communications manager, and we can definitely get that set up at a later date as well. So thank you so much, everyone. It's been brilliant. Thanks a lot, guys.
Bye. Thanks, everyone.